Fine, there are 8 more sectors are there. Home-based service is good. Home care is a separate sector. Home health care, home nursing care, different keywords, but it's a separate sector. Business format is different. Other than hospital, there are different. Licensing, right now there is no such, but yes, infrastructure is different. The need of infrastructure kind of things are the training, the resources are different. So we consider it as a home care is a separate sector. Although, see, whatever sectors we are discussing here, there is no any textbook definition or list. So you can claim, you can counter it, no problem, I don't mind. These are my thought process, and these are things which I have observed. I am for the academic discussion and to understand healthcare industry in a different way, I have put 18. And I would appreciate any of you at the end of this discussion if you suggest any further new sector. That will be great for the learning. Public health, yes, good. Public health. What comes under public health? Okay, immunization means that pediatrician also do in that clinic do immunization. Does it call public health? Okay, policy making, but complete it. The hospital manager is also preparing the policy for his hospital. Yeah, they complete that sentence, right? Government health policy, that comes under public health. Now what else? Consultancy means you are the another sector you are talking about. But in public health, we come to that point that consultancy is separate sector. But let us discuss public health. What you can include in public health? One is government policy, health policy, right? That's public health. Second, you said immunization, but we need to be precise that government immunization program, right? Because they initiate to entire country for particular vaccine programs. Likewise, recently the COVID vaccine, there is a separate things going on. So there was one in a public health, it's a part of public health, right? Statistics comes under in public health, where you see at government departments, they looked at what all are health statistics of particular community or particular city or a state or a country, right? Any other aspect in public health you consider that these all certain things will be there. Why we are discussing it? Because to understand public health, we should know that what all are things there in public health. What will you consider? One is, of course, the immunization programs, the government programs in immunizations. Second is the health policy, government health policies, health statistics, things going on.
Give benefit of public such as Asha, Anganwadi, and
yeah, so there are kind of children health programs, kind of preventive health is part of the public health. So preventive health programs going on, right? One more important aspect still we are missing it. What? Health emergencies means primary health care things also included. Okay, good. Targets to reduce disease burden means okay, so means we will be working on preventive health aspects, or yes, one more important aspect we were missing is disease awareness, right? That's the one of the major subject and one of the major activity comes under public health. Now 13 is healthcare consultancy, right? So these are like quality accreditation agencies are there. There are hospital planning and designing agencies are there. There are hospital operations and management consultancies. There are healthcare recruitment consultancies. There are healthcare licensing companies. There they do registrations and licensing and different aspect. Okay, just I came the point. What do you mean by registration, license, certificate, accreditation? Just you explain what you understand with this terminology. All
Entry of data, registration.
means
Like you are registered your name, your contact number, where you came from, what is the purpose of the visit, what is the purpose of
okay. It's a kind of registry. Let's say I buy a car, I need to register it at RTO. That this car owner is this is his license is this and all, right? So that registration is a registry. What all are registrations in hospital? Okay, patient registration things going on. Okay, any for the hospital any registrations are there?
operating, what registration date, register,
Even the hospital itself need to be get registered.
Yeah, but okay, but do we? That's the clinical establishment registration, right? They call it registration, but should we consider it registration or a license?
It's more license, but again associated with registration.
Yeah, okay. How we can understand the difference between registration and license?
Registration is a process.
But license is also a process.
license means like consequences, medically you are responsible something.
But for registration also, that's a it both has a medical legal or legal importance. Both has.
License to practice. License to practice.
Okay, license means the basic characteristics of license is if I don't hold a particular license, I cannot perform particular activity. That's the basic nature of a license, right? So if I don't carry a driving license, I cannot drive a car, right? But if I don't have a driving license, but I can buy a car and register it to the RTO, right? Got it? These are basic difference. Now we come to that hospital registration. Can I run a hospital without getting that corporation registration? No. So I should treat it as a license, right? Because I without that document I cannot perform. I mean, if I am a doctor, if I don't carry, we call it medical registration to the council, but it's a license to practice, right? If I don't have a license to practice, I cannot prescribe a medicine to a patient. So, basic license nature is permission for particular activity. Another key aspect in license is there.
License has to be renewed, but registration.
Particular period. You cannot get a license for lifetime. You need to renew. You need to prove your ability or and your criteria for that particular thing. So license has a particular period. So there is an expiry feature in that particular license. Okay. Certificate. What does it mean?
Certificate of attendance. I mean, like you acknowledge something that this is happened, like certificate of attendance, certificate of birth, certificate of date, particular.
So it is a kind of evidence to record a event, or what all are other characteristics of certificate? It certified something. If I have attended this seminar going on perspective of healthcare industry or so and so, whatever, I got a certificate. That evidence, okay, you have attended particular seminar of so and so, right? What other characteristics is like in license? There is a particular time period. Does certificate has that particular time frame also? Right? It's a one time. After 2 years, you got an MBA hospital and healthcare management degree. That's a certificate in nature. You need not to renew your degree every 10 years or 5 years or so, right? Whatever your performance is, you got a degree, means degree, you are a degree holder. Whether you are a good performer or a bad performer, doesn't matter, but you got a degree. So that's a certificate in nature, right? Same wise in hospital, you issue death certificate, you issue a medical fitness certificate, right? And then accreditation.
Maybe applications like that.
Yeah, but then it's an example, right? Now, what is the difference between certificate and accreditation?
You have to have particular things to have a checklist. You have to
But
have
in certificate also there can be a checklist, na? In license also there is a checklist. License to practice, they give me a checklist. You have to particular degree, you have particular training, and then we will.
up to the mark or quality. Quality check.
Quality check should be there in accreditation.
It is done by an external body.
Okay, there is one feature, sir, that it is peer reviewed in nature. Peer reviewed in nature. Accreditation is. Yeah, license also, on the license I can run my department. I'm practicing, let's say orthopedic surgeon, and I can run my department on that license.
More credibility to the services.
It has some recognition value, right? Credit or recognition value is there in accreditation.
Compliance to the
Compliance to the,
observations.
there are standards to comply, right? So there are set of standards. Now let's, if we complete it, that accreditation is something which is voluntary in nature. Nobody force you to get NABH accreditation for your hospital. You can run your hospital on the basis of registration, a doctor's license, and the certificates, different things you can run. Nobody force that you must have a NABH accreditation. So it is a voluntary in nature. And if you want NABH accreditation, you have to comply with the particular standards. It will be peer reviewed by the agencies, right? Then it will recognize. They will put certain terms. You need to renew 1.5 years, every 3 years, etc. But these are the basic things for the accreditation. Clear? So registration, license.
Bit overlapping, I have a question regarding this. When you talk about the various TPA companies which are in picture, so whenever you get, they need to have a kind of affiliation with them. So again, it comes your NAB accreditation comes and become mandatory.
Uh,
Um,
they don't put mandatory, but yes, sir is putting the aspect of that there are health insurance companies, right? They provide cashless service. So does it mandatory to get NABH accreditation for particular health insurance tie-up or so? So there are different things in there. If a health insurance company, I think most of the health insurance company, they have once you apply, if you are a hospital manager or owner, if you are apply for this cashless tie-up and all, they approve, the insurance company approve your hospital tariff on a mutual understanding tariff, right? Now, health insurance companies has a one clause that if you are a NABH accredited hospital, then we will give you 10% or 15% on your tariff higher than that. So that's the additional value or kind of additional benefit they put. Even in government schemes also. In Gujarat there are Ma Yojana. In Ayushman Bharat is India level central government scheme, right? In that also they have put this clause that if you are NABH accredited, you will get this, any of the package amount is there in a scheme, you will get additional benefit of this percentage. So that is there, but they cannot mandatory is because the government is allowing the hospitals without NABH accredited. So it is not mandatory. So insurance company cannot make it mandatory. But yes, they are putting, giving additional benefit on the business benefit, basically, right? So that was the fourth sector things we include. There are long-term care center, you can say. Now it can be old age homes, it can be psychiatry treatment separate centers, it can be de-addiction centers, it can be a hospice, but there are separate sector of long-term care sector centers. Anyone has this idea, long-term care centers? Yeah, but in India you will less find such center, such setups. But if you see Western countries, in UK, US, you will find such centers. In England, there are long-term care centers for people who have chronic diseases or geriatric patients who are, they need basic nursing care only. They have ongoing medicines and certain basic nursing care and assistance they require. So they go to long-term care centers. They are, that such center is not a hospital, but they provide nursing care. They have maybe a visiting physician is there, and any kind of medical emergency and further treatment require, the nursing assistant, the healthcare assistant will bring that patient to the hospital. Like, and what are these hospice? Anyone? Yes. People, patients who have end stage diseases, end stage cancer disease or some organ failure and all, where there is no treatment available, they only need, they are only depending on certain medicines and nursing care till their end of their life. So there are dedicated centers, hospice centers are there. In India, there are less number of such centers are available, but in Westerns, yeah. Huh? Okay. In Banaras, yeah, somebody says in Banaras there is Yeah, so in such centers, there are doctor, even at the time of death also, they do all this kind of formalities, things are taken care in that hospice center. So the hospice center is also, if you, as a MBA student, you can consider it as a opportunity, one of the opportunity in healthcare, because there is, the demand is there, the supply is less in the industry.
हेल्थ केयर में करियर चूज डॉक्टहब।